health officials who were part of an effort to combat drunken driving in Wisconsin say they no longer want anything to do with it. In a letter to the Department of Transportation, they say they're resigning from the OWI Impaired Driving Task Force. NBC 15's Madeline Anderson has more on why they left.
Every year, around 200 people die on Wisconsin roads from drunken driving. One former task force member says the key to lowering that number is by curbing binge drinking. But he says the state is reluctant to look into that approach. In August of 2013, members of the Impaired Driving Task Force approved a plan to better prevent alcohol-related crashes. Dr. Richard Brown says he was left out of the conversation.
I was asked to join about 2 years ago. And since then, there have actually been no regularly scheduled meetings. When there have been meetings, they've been called very quickly and have never left me an opportunity to attend.
Brown is well versed on the topic. He administers programs to help clinics systematically screen patients for substance abuse and teaches a course on the same topic at UW-Madison. He and 3 others are quitting the task force because they say their professional opinions were ignored and that the Tavern League is the only non-governmental partner.
I was concerned the Tavern League was the only organization mentioned. I was even more concerned that the recommendations in the document were very anemic.
The state is promoting transportation alternatives and education. Dr. Brown says that doesn't work as well as sobriety checkpoints and higher alcohol taxes.
We know very well what could actually be effective. Unfortunately, the state is not moving in these directions.
But the state says it has data to prove we are in fact moving in the right direction. Wisconsin DOT spokesperson Peg Schmidt says alcohol-related fatalities have decreased 19% since 2009. While those numbers are encouraging, Dr. Brown says the current strategy isn't a long-term solution.
I think a lot of people say that there is a strong alcohol culture and people are somehow fearful of addressing that. But in reality, most individuals in this state do not engage in binge drinking. Most don't engage in drunk driving. There is a large silent majority that I think may not know that there are effective policies and programs that could be implemented. And I hope my colleagues and my resignation from this committee helps bring that to light.
And the Impaired Driving Task Force is made up of 38 members from state agencies, tribal government, law enforcement, public health, and communication organizations. The DOT says the Tavern League has only 1 member on the task force.